The Hawaiian Beacon Project has a couple of focuses. One of them is around health information technology and being able to share information across providers, from one provider to another, from a primary care to the hospital to specialists, and vice versa. The other aspect of it has to do with care coordination, about the people and sharing of information. Both elements are critical to having a strong healthcare delivery system. You think about it from the context of a patient goes into the emergency room and that emergency room doctor doesn't know anything about that patient, doesn't know if that patient has allergies, doesn't know what the various problems are. So they're dealing with it in a silo. And the Beacon community is designed to break down those silos between providers, break down it in terms of information technology, as well as break it down between the care coordination and the people who are providing the coordination of care.
The care coordination program here at West Hawaii Community Health Center is a very important program. When we identify patients who have complex health issues, we bring in the care coordination folks, and they help us to address all the different needs that the patients have, whether that be, you know, they need help in the community or behavioral health needs or whatever it is.
It's about making sure that we're facilitating the care of that patient in a process that's structured, that hopefully assures continuity care for that patient at every level of their health. So whether it's from beginning to end, whether it's chronic care condition or whether it's end-of-life care issues, we're coordinating and facilitating that care, hopefully, so that they are getting what they need. You have to kind of assess where they are too. If they're not ready, it's not gonna happen. So if you can assess where their readiness is, that's probably the person that you can affect the most. And so, you know, a lot of that is just assessing and making sure that that patient speaks for themselves, or the family speaks on behalf of the patient as well.
As a patient navigator, I go out into the home, visit with the patient, and then come back, and as a team, we discuss how the visit went and how we all can play a part again when we do have another visit with the patient. So it's really the team effort here. I go in and really enforce it with the patient and really look at the bigger picture and see which of those concerns that the doctors or behavioral health have that the patient would like to work on first. Okay. Because when they feel comfortable in being part of that service plan, then they more than likely will follow through.
Because we have care coordinators going into their homes and talking with them at maybe the very table where they speak to their families about their important family issues. And when we have a behavioral health therapist in the exam room with them before the doctor gets there to help them deal with anxiety, to help them deal with their fear, to help them utilize the relaxation skills that they've maybe worked on with that therapist for the last 3 weeks. That brings a sense of calm, it brings a sense of comfort, and it builds relationship. And in many cases, those dynamics are the seed of healing. And allowing the patient to feel comfortable and safe and secure is going to open them up to following a treatment plan and listening to their doctor and improve communication. And then the medicine takes care of itself after that.